Third of the month, time for Buddy Check 3. This is our way of reminding you to remind a buddy to follow the guidelines that can catch breast cancer in its earliest, most treatable stage. And that begins with your monthly self-exam. But this summer, the National Institutes of Health announced a new product that could also identify breast cancers between mammograms. Lisa Rose has more on what's called a wearable ultrasound.
We know mammogram screenings save lives. What may surprise you is that some women have felt a lump in their breast within a few weeks or months of a clear mammogram. Well, now an associate professor at MIT has developed a way to detect even the smallest of tumors by wearing an ultrasound device that can monitor any changes in their breast as often as they want to. This is what cutting-edge ultrasound looks like today, conducted in an office by a trained technician. It's usually the next step when a mammogram reveals something suspicious or when a woman has a higher risk for breast cancer.
Ladies who don't have cancer, don't have symptoms of cancer, but have a high risk, either because they have a genetic mutation or they have a serious family history that elevates their risk, and they're getting close follow-up as it is. And close follow-up usually means we see them every 6 months or so.
But imagine being able to have an ultrasound daily at home, on your own, recording any potential changes in your breast and sending the video to be monitored by a professional. That's what this wearable ultrasound may be offering in the near future.
It's a device that is connected to a bra that a patient can wear, and then there's an ultrasound transducer that's connected to the bra, and then the patient can move that transducer around and take several pictures of their own breast at home anytime they want, and then that's stored. The software that's associated with the device stores that, and then they can take another picture the next day or the next week, and then the software will compare the pictures.
It would offer peace of mind for some patients, but it could also change the course of treatment for others.
This might shift some of those patients from having, prophylactic mastectomies to screening if they know I can screen myself every day if I want.
Developers at MIT expect to set up clinical trials over the next year in which hundreds of women would test the wearable ultrasound. After that, the system would be submitted for FDA approval. It may be 4 to 5 years before we actually see it in widespread use, but doctors are hopeful that this will be another way to catch breast cancer in its earliest stage. For now, though, don't forget to join our Buddy Check 3 system right here at ky3.com so we can remind each other to follow the guidelines we already have to troubleshoot breast cancer. I'm Lisa Rose.